Have you ever noticed that something you once enjoyed in small amounts now requires a lot more to achieve the same feeling or effect? Perhaps your morning coffee does not quite give you the same boost it used to, or a certain medication seems less effective over time. This common experience is often called tolerance, and when it comes to substances like alcohol or drugs, it can be a significant early warning sign. Essentially, an increasing tolerance to a substance signals potential addiction because it shows your body is adapting and requiring higher doses to achieve the desired effect. This adaptation is a foundational step toward developing physical dependence, where your body physically needs the substance to function normally, and it often paves the way for a full addiction. The core mechanism behind this is called neuroadaptation, where your brain adjusts its chemistry to the constant presence of a substance. When you regularly introduce a substance, your brain tries to maintain balance, either by reducing the number of receptors that respond to the substance or by producing opposing chemicals to counteract its effects. This means your system becomes less sensitive, requiring more of the substance to trigger the same response it once did. There are different types of tolerance, including metabolic tolerance, where your body gets better at breaking down the substance, and cellular tolerance, where your brain cells adapt directly. These adaptations lead to a cycle where the person seeks higher and higher doses, often without even realizing the underlying changes happening within their body. This constant escalation places immense stress on the body and can lead to dangerous levels of consumption. To recognize if tolerance might be signaling a deeper issue, consider if you or someone you know is needing significantly more of a substance to feel its effects. Observe if the amount used steadily increases over time, or if the original intended effects are simply not felt anymore at the usual dose. It is also important to note if a person uses more than they intended to, specifically to achieve an effect they once reached with less. It is crucial to understand that while tolerance is a powerful indicator, it is not addiction itself. However, it very often co-occurs with psychological dependence, where the mind craves the substance for emotional relief or pleasure. Together, these factors create a powerful drive that can quickly escalate into a full-blown addiction, making early recognition incredibly important. Recognizing this escalation of use, where an individual repeatedly increases their intake to overcome diminishing effects, is a critical early warning sign. While some substances develop tolerance more rapidly than others, any noticeable and sustained increase in usage to achieve the same result warrants attention. Understanding tolerance empowers you to identify potential issues early, encouraging timely conversations and professional support, which can make all the difference in navigating challenges with substance use and promoting overall well-being.